on this edition of Insights on PBS Hawai'i. Guns and mental disorders have proven to be a lethal combination time and again, but most families living with mental illness cope in private without such traumatic consequences. How is our state and community supporting them, and what more could we do? Now, live in our studio, our host, Dan Boylan.
Aloha and welcome to Insights on PBS Hawai'i. I'm Dan Boylan. The massacre at Sandy Hook Elementary School in Connecticut last month was just the latest in our nation's history of gun violence. Often mass murderers have two things in common: mental instability and access to guns. Though the vast majority of the mentally ill are not violent, and Adam Lanza's diagnosis remains unclear. The Newtown tragedy reopened America's gun control debate. It also highlighted the need for more public awareness of mental illness and a more comprehensive system of mental health programs and services. Tonight we'll explore Hawaii's commitment to mental health care, and next week we'll examine our state's gun control laws. Many of you have firsthand experience with our mental health system, or lack of one, and we hope you'll weigh in over the next hour. How big a priority is mental health in Hawaii? Is the system effectively serving individuals and families? What new laws or policies do we need? Can you imagine anything like the shooting in Connecticut or Colorado happening here? You can join our conversation by calling, emailing, or tweeting your questions and comments. The contact information you now see on your screen will be repeated throughout the program. Insights is also available live on your computer screen at pbshawaii.org. As always, the video will also be posted online after tonight's program. Now to our guests. Marya Grambs is Executive Director of Mental Health America of Hawaii. She approaches this issue from both professional and personal perspectives, with a master's in clinical psychology and a diagnosed mental illness. Marya has founded and directed nonprofits for the past 35 years, dealing not only with mental health, but also women and children, violence prevention, and poverty. My inability to deal with her first name may be the last light point we have in this program. So please, I'm sorry, however I've dealt with it. Connie Mitchell is Executive Director of the Institute for Human Services, the largest nonprofit serving Hawaii's homeless population. Connie is a psychiatric clinical nurse and was previously Director of Nursing at the Hawaii State Hospital. She was also on faculty at the UH School of Nursing and helped establish a rural mental health clinic on the Big Island. Noelani Wilcox is a retired nurse who worked in state government for more than 30 years, most recently as Chief of Public Health Nursing. She was also a psychiatric nurse in the state's Community Mental Health Program. Noelani serves on the State Mental Health Council, and she has years of personal experience advocating for her son, who was diagnosed with mental illness in his early teens. And State Senator Suzanne Chun Oakland currently chairs the Senate Human Services Committee and has a long record of support for social services. Senator Chun Oakland has served in the state legislature for 22 years, and her district covers the areas from downtown to Kalihi. This was certainly one of the most shocking things that I've seen in the last 50 years. 20 children, first graders, 6 educators being shot in a mass killing. I just wonder what all of you in sort of the mental health business and dealing with the mental health system, what you thought your first responses were to that. Marya, what was your first response?
Well, just like everybody, it was horror and feeling devastated. But my next response was, I hope this is not a person with mental illness, because we see some of these tragedies unfold, and some of them are by people with mental illness, and yet the facts are that 80% of mass murderers are sane. So, there's really a misconception out there. But when one of these very brutal events happens, it, puts it in people's mind that people with mental illness, are bad and violent, and then that adds to the stigma. And the stigma of mental illness, which means people don't understand it, they don't like it, they think people are wrong or bad who have mental illness. So these events increase the stigma. and that increases the shame people feel, that increases the people not getting help. So it's a vicious cycle. So when I hear about these things, I get very sad and very upset, not only for the victims, but for what this is going to do for the many people who have mental illness.
Yeah. What was your response, Connie?
Well, I think after the aftermath of, just trying to understand what was going on with the gentleman, I think I also hoped that it was an opportunity for us as a community to look at, as you said, could this happen in our community, and what can we do to prevent something like this from happening? Do people pay enough attention to other people and perhaps some symptomology that just kind of goes unnoticed or just disregarded in some cases? Because it's just too much trouble to go and ask some more questions sometimes. So I do think that the awareness is an opportunity, for us to really take a look at what we can do.
No, but it did happen in our community. The Xerox shootings, seven men lost their lives when I can't remember the man's name, Yusugi?
Brian Yusugi.
Brian Yusugi. It did happen. And how did he fall through the cracks? I mean, how does that happen?
Well, I wasn't sure whether he was one. I believe he may have been diagnosed before, and that's one of the concerns that we have, is that when someone is diagnosed and has gotten treatment, many times people don't continue with the treatment. And we really want to see people who have been diagnosed and at least gotten some treatment stay on treatment. And then those people who never ever want treatment, we want to be able to reach out to those people so that they will access the treatment that they need. But sometimes our current laws just are not that helpful in some ways. And that's one of the reasons why Senator Suzanne Chun Oakland is hoping to introduce a bill, to help us with that. And maybe, Susie, you want to talk about that a little bit?
Tell us about this bill, Susie.
It's called Assisted Community Treatment, and basically over maybe a 3-year period, there's been a number of parents that have come forward, and their adult children they see them deteriorating. They may be actually living at home, but as an adult, parents can't necessarily interfere with their adult child's life. And so what this bill will do is help support these individuals that may need additional care. They probably have been in and out of hospitals, and so this particular proposal would help, I think, for those that have been in and out of the hospitals and on the streets, possibly because they don't get the treatment they need.
Noelani, how did you respond to it when you first saw it, and what is your immediate response that I mean, two of the bills, as I understand it, both the president's and the New York bill, which has already passed the New York legislature, put a lot of emphasis on mental health and among other things, having people who it appears are a threat to themselves or to others, that they can be reported. And as I understand it, psychiatric folks don't think this is a good idea. I wonder what your thoughts are on that.
I think that when parents, family members, concerned people in that individual's life, they need a way of getting assistance. And assistance should not be the first response being the police department. As much as the police are very important, we want to intervene much more earlier. I mean, parents want that. And they don't want to wait till things get so bad that the police have to be called. So it's a whole process of engagement. And when I look at treatment beyond just medication. It really is about engaging people in life, having basically a built environment. And it's not just for people who are mentally ill, it's for everybody. I mean, we have to promote better mental health. And so I think that that's very important.
Well, it seems to me in these most recent, Adam Lanza, that Dylan Klebold and Eric Harris in Colorado, the shooting up of the school, James Holmes, the Dark Knight fellow went into the theater, Jared Lochner in Arizona took out a congressperson and 12 others, or Sung Hui. Cho and Virginia Commonwealth. All of these men were committing suicide, or I guess two of them didn't, Lochner and Holmes, but they were most certainly appeared to be mentally something wasn't engaging them. Life was not, they were committing suicide and they decided to take others with them, weren't they?
Right. I guess my concern is, too, I mean, because we have a lot of murders happening all the time. I think since Sandy Hook, there's been like 900. 900,
the president said.
Yeah, 900 killings since then with guns. And I think the media, to a large degree, you know, brings out all of this about these particular people. And I think the ones that you mentioned, you know, did have some mental illness involved. But I mean, people are dying every day from guns. And I think we need to put that into perspective as well. I think there's a, you know, people a lot of times are fearful. And fear begets fear. And we don't always pick up early enough when people are in trouble or just need a kind word. A lot of these young men, I mean, we're young men. Impulsiveness is also something that contributes to that, along with substance abuse. You know, so it's not just mental illness, it's along with substance abuse and also being very impulsive. And so impulsiveness is not necessarily a mental disorder. So I mean, we have to, you know, it's easy to make judgments, and I understand people's fear and concern. But I think we need access for when people have concerns or questions, that there's easy access to get assistance. I think this law is a great avenue for that to begin to happen.
Well, I think, you know, that if we look at this society and the way we care for people with mental illness, it's really a disgrace. I mean, I can't think of any other word for it. The big, huge mental hospitals of the old days, where people were locked up, you know, it was a snake pit, they were chained to beds, they were getting no treatment, it was filthy. Well, those doors opened, and everybody said, well, these people should be in the community will take care of them. They can take medication and they'll be okay. Well, that didn't happen. And so you have severely ill people who aren't getting help. And you said a minute ago, how did this person fall through the cracks? Well, it's all cracks. We don't have a comprehensive community mental health system anywhere in the country. And the recession took out billions of dollars from a mental health system that was already not good. It happened here in Hawaii. You know, our state Department of Health and Department of Human Services are trying to rebuild that, but we've got a long way to go. So you see, you know, it's no surprise that you see people on the streets that are talking to themselves.
What we have seen, though, that has worked is things like the clubhouses. Yes. You know, when you have opportunity for people to socialize, be able to actually experience things where they can be productive citizens, actually be employed to the greatest extent that they can. We've seen the hospitalizations, emergency room visits go down significantly. And so what's very exciting about what's happening recently is the Department of Human Services, that is covering a lot more persons with mental illness, is seeking a waiver from Medicaid so that we can cover things like Clubhouse, like rep payee services.
What are the clubhouses? I don't quite understand.
Yeah, it's a place where actually persons with mental illness can actually socialize. They learn different kinds of things that actually allow them to engage in the greater community.
And rehabilitate, because there are a lot of transitional employment opportunities right there in the clubhouse. And so they're really getting.
And if you go to one, they're bright, airy, wonderful places, and you walk in and you feel good.
Where's one, for example?
Waipahu, Connie
area,
Diamond Head, Central Honolulu.
Leeward, Waianae.
They're throughout the state.
Yes, throughout the state.
Actually, a number of the folks that are club members, they come to the legislature every year. They're actually self-advocates, and that's really something I think that's to be proud of. We just need to be able to fund more of that, and I'm glad that we are able to, with our insurance program, hopefully get approval to cover those kinds of services.
But we also need private insurance to cover such services. A lot of the private insurances don't have a comprehensive range of services that they provide. And so if you happen to have that insurance and it's not covering Clubhouse, you can't go to one.
Noelani, you have a child who has suffered from mental illness. What are the obstacles or problems that you've found in trying to find treatment and to deal with it?
Well, he's very good about taking his medication, which is good. But I think one of the things is once you get out of school, there's not too much. And he's in one of those gap areas where he's not able to be a part of Clubhouse because of our insurance carrier. So, you know, I'm glad to hear when Suzanne says that these are some of the things that are going to be worked on, that he can then have access. I love Clubhouse because it provides a social connection, and it's peer-to-peer. And so people learn from each other. And there I may say also the staff learns a lot from the people they serve as well. So I think that that is always a good avenue to connect people, and all kinds of people, because community people also come in and volunteer and do different things. So it's a great way, and it's an important part of our mental health system. It's an important part of treatment.
There's also another bill that we're introducing to help support peer specialists. So these are consumers that actually can help other consumers of mental health services, and oftentimes they're a lot more effective in actually engaging with their friends and then being able to get them stabilized on their medication. So I think we need to incorporate more of these best practices into our system.
Connie, you see hundreds of people every day, many of whom have some sort of problem or another, either addictions or mental health or whatever. In both the New York bill and in some of the president's suggestions, people are supposed to intervene. You must have a practiced eye by now. Have you had to report people or call for intervention beyond what IHS could offer?
Absolutely. It's actually part of our operations that when someone comes in, we do a comprehensive assessment of that person on intake. So we're asking questions, and if someone appears to maybe need some help, we immediately look to having someone assess that person and call the access line, which is the state's mental health resource. So someone is asked to come down and evaluate that person and to determine whether they do, in fact, qualify for services from the Adult Mental Health Division. So we make a practice of really making sure that those people we feel like are mentally ill or have those symptoms get evaluated. And to follow up on what Marya had mentioned earlier about, you know, how when they deinstitutionalized the hospitals and they came out on the streets. Well, we recently received a SAMHSA grant from the federal government, and we really are looking at chronic homelessness. And in the first 7 months of our study, you know, in doing it, about 59% of those that were chronically homeless actually reported that they suffered from symptoms of mental illness. That's almost 60%. That is a significant number of people who are chronically homeless. And, you know, I'm not just saying that they may have like a serious major mental illness, but the depression, the anxiety, all of those things are part of their mental health or mental illness at that point. So we're really looking at a group of people that are very vulnerable to mental illness.
But how do we develop a system, whether in Hawaii or nationally or in various states, a system, truly a system, whereby people like Klebold and Lanza and so on, that they're not going to, Lanza appears to have been isolated at home with his mother and 5 guns, right? Now that's not, is there a way that can be dealt with, or that we can create a system that big, that strong, that foolproof?
Well, you know, one of the suggestions, and I think it's a good one, and it's been tried in some places, is to locate mental health services on schools, on school campuses. So there's counselors, there's social workers, there may be psychiatrists and psychologists, so you don't have it separate. You You know, so if somebody is having problems, it's not like you're going to have to take them over to a mental illness place, but teachers can be sensitive, parents can be sensitive, other kids can be sensitive, and then kids can get help right there. So kids like Adam and kids like Jared, you know, people would notice. I mean, people did notice, but the resources were very hard to get, and there's such a stigma about it.
Well, look at this university, Virginia Polytechnic, Sung Hui Cho. I mean, they thought many students said he was a risk, many teachers he was threatened by, but nothing was done.
Yeah, well, what kind of mental health services were there on that campus?
Well, the other thing is, I think beyond having the services available, I think we as a community need to be willing to get involved. If you see someone that is, you know, acting in a way that seems like they might be suffering from mental illness, to do something about it. I am, you know, just so often gratified when people call us about someone who's homeless. Now, they don't even have to be, you know, acting strangely, but, you know, they're really wanting to get help for that person. And so I think for people who are mentally ill, if people saw and observed some of these behaviors and really reported it and knew where to report it, it would make a huge difference, because it's really people caring about other people, basically.
Yeah, and it's not so much even always reporting it, but if you're a neighbor and you see a family next door, and maybe it's the parent who's mentally ill, and maybe the child is there, you know, kind of suffering silently because the parent has a mental illness, well, go over to that family, go to that child and try to offer some comfort, talk to that parent, and vice versa. If you think there's a problem with the kid, talk to the parent, try to help them get help.
I think part of the examples you had cited, I think there was also bullying. I mean, there was you know, not treating people well. So that is pervasive. It's not only people with mental illness. When you treat someone in that manner, there's anger in them and things can happen.
And if you stand by and you're a kid and you watch it, you're really telling that bully it's okay.
You said that one of the great things about your son is that he stays on his medication and so on. But aren't there, in fact, patients who don't want to be on their medication and stop being on their medication because it sort of flattens life out and sort of flattens out their nerve endings and so forth? I'm simplifying as only a layman can, I guess. I apologize for that. But isn't that a major problem?
Yes, it is, and it also becomes a reason not to take medication. I think that you know, medication is not a perfect science, and a lot of times when people first start medication, they feel lousy. You know, they're very tired, they're very sleepy, they just don't feel like they're functioning, and it's worth living. And so a lot of it is working very closely with the prescriber, with generally maybe a psychiatrist or a nurse practitioner, to try to find that right dosing for that individual. And at the same time, beginning to engage them in whatever activities that might be. I think schools have an important part. My son was diagnosed when he was quite young. He was 14 years old, so he was still in school. So the school he was attending was very good about keeping a place for him. He was going to a small private school. They came, they went to see him, you know, and he basically asked to return. And so it was a nice, they worked well with him. But in some situations, I've heard parents say where schools are afraid. You know, they don't have the support. They may not have the staffing to be able to deal with what may come up, all of the what ifs. So I think it's important that there be plans in place. You know, what are some of the things that kids can do or individuals can do to help them feel better? What are those activities? What are the triggers or things that might be upsetting for them? So it's a lot of planning, crisis planning may be involved.
Susie, we're talking about creating a system or bringing back some of that money that was lost since the economic recession hit Hawaii. But I understand that we want to have early childhood education, which I think you would not vote against. Knowing your basic instincts, you would not vote against that. And there are all sorts of people fighting for this kind of money. How do you get the money, sufficient money to bring back or to develop a system that really gets to every kid or who's suffering or any or adult?
Passing some of the legislation that we just mentioned so that you don't spend it in the emergency room and you don't spend it on things that really, if we had these kind of more prevention or early intervention services, we wouldn't have to spend in this area. We could infuse it or support the more prevention services. And by actually getting approval, I hope, from the CMS feds, to cover the costs of some of these services, like the clubhouse or rep payee or housing specialists, etc., that will have, there will be a shared expense. The state doesn't have to totally have that burden, that cost burden anymore. There will be a shared expense with the feds. So I think we just have to think smartly. Where are we putting our money? It's very wasteful to me, even using law enforcement and going, all these other things that we're spending so much money on and redirecting it to something that makes better for the quality of life of people.
And saves us all money, right?
Yeah.
Pay now or pay later.
Charles from the Big Island says, I'm a retired engineer and my wife is a retired doctor. Yes, there is a mental health problem that needs to be addressed, but the real problem right now is controlling guns that are meant for killing people. It is a mental illness to want to own these guns. Charles, send this back next week. This comment. I don't know. Does anybody want to respond to that?
Well, I totally agree with it. I totally agree that we have way too many guns, and why do we need assault weapons, and why do we need magazines that have 10, 20 bullets in them? I mean, it's carnage.
Actually, Hawaii has one of the most stringent laws.
Yeah,
so I think in terms of our state, there has been that kind of attention spent.
We don't have as many guns as most states.
And I think also, most gun owners are very responsible. We do already have a safekeeping kind of law where you have to keep it safe, otherwise you become liable. So I think Hawaii has addressed that particular area. I think it's more, how do we actually resolve any kind of conflict in more peaceful ways? That's why, having the Department of Education as an example, really invest in safe schools. They have a Safe Schools initiative, teach from a young age how to resolve things in a more peaceful way, not having to utilize things like guns to resolve problems. So it's investing in a lot of that early on.
That's great.
Liz from Waikiki says, does having mild depression and seeing a counselor and taking a mild antidepressant classify me as mentally ill? Will I carry this stigma with me forever? Any thoughts?
Well, depression is a mental illness, but I think what we're working toward is trying to reduce that stigma or erase that stigma. We need to be able to admit when we're suffering from any kind of illness. As a nurse, one of the first things that really a light bulb went on inside of me is, for people to understand that mental illness is an illness, just like any other kind of medical illness, except it's affecting the brain. And so the people that are suffering it need treatment, just like somebody who has a broken leg or has diabetes needs treatment of that kind. Now, the person who's suffering from mental illness, though, inherent in the illness is their ability to understand what's happening to them. And because they can't fully appreciate what's happening to them in their brain chemistry, they don't always make the decisions that would be best for them sometimes.
I think we also need to highlight those that have mental illness that are doing very well. I have the privilege of working with many people at the legislature, and we have a group of consumers, and their friends that have worked over the years.
There's somebody out there saying, we know the legislators. We know who you work with at the legislature.
But they're actually, consumers that have taken control of their life. They do take their medication. They have full employment or partial employment, and they're actually contributing towards making our state a lot better. So I think people need to see those that have mental illness that are really making a difference. Marya, as an example, actually I didn't know she had mental illness until she disclosed that to me. I just knew that she was the executive director of this organization. But I think there are people that are very productive.
And
so-
we have to not feel ashamed, you know,
Right.
to say, you know, I've been in a psychiatric hospital, you know, I'm an ex-mental patient, I take medication, and I'm not ashamed of it. It's not something to be ashamed. You know, I didn't do it deliberately. I didn't, you know, say, okay, I think I want to be suicidal today, you know. So if more of us can feel brave and feel not ashamed and speak out, I think that can do a lot to reduce stigma.
And I think seeing the picture of recovery, knowing that it's an illness that people can recover from, is really important. Just like I was saying, you know, somebody who has diabetes can take medication and have a life, you know, a really a quality life. Somebody who has a broken leg can recover and begin to do the sports that they enjoyed before also. Same thing, you know, there's recovery possible, and we have to give people that opportunity.
But things like these mass killings leaves the impression in people's minds, and maybe it's the media's fault. I would argue, you know, it seemed to me that's part of the blame. The media goes from one story to another story to another story, and the impression is that the stigma just gets underscored.
It gets worse.
Because instead of talking about mental illness and have it, you know, we end up talking about mental illness and a mass murder.
I know. And 80% of the mass murders are sane.
Right, and those 900 people who died most of them did not die from mass murders involving mentally ill. They're gangbangers or whatever in Chicago or New York.
Domestic violence.
Or domestic violence, right. What benefits were supposed to accrue from privatizing so many of the services previously provided by the mental health centers administered by the Adult Mental Health Division of the Department of Health? What kind of oversight is provided to ensure that the services by the private providers are being performed properly and conscientiously?
Well, I know there was that transition several years ago where a number of people who have private insurance transferred from the Department of Health to Department of Human Services. It did not cover a number of the services that the Department of Health did, and that's what I was mentioning earlier. Finally, the Medicaid division is seeking a waiver so that many more meaningful social and health services can actually be covered under Medicaid and the private insurance.
Peggy in Maui says, do they ever put pamphlets on bulletin boards in banks and public areas for people to call for mental health help? Sometimes people just need to know where to call.
Well, I think one of the numbers you can call is the Mental Health of America number, and Marya, you can give them your number.
It's in Oahu, 521-1846.
Repeat that for me a little louder. 521.
On Oahu, 521-1846. We're not a crisis line, we're a helpline. And what we try to do during work days is connect people to resources. And we have a chapter on Maui, and their phone number is 242-6461. And it's the same thing. People call and they say, I don't know how to get help. Where can I go? How can I help my child? What about my husband? You know, what about myself? I need help, I don't know how to get it. So please feel free to call us.
Do you have a website as well?
Yeah, we do.
Can you
Absolutely.
please share that?
It's www.mentalhealth, one word, -hi.org. And we have a lot of information on our website. We also have a 25-page resource directory. It's a phone list of virtually all the services in Hawaii that deal with human services.
Why aren't maximum efforts made to connect patients who are being discharged from a hospital to community facilities and services? It is well known that patients who are not well connected will more than likely have a relapse. The result is a revolving door in and out of hospitals with no improvement. Scarce funds are squandered.
Because we don't have the services. I mean, the Department of Health and the Department of Human Services are trying to build back those services, but you know that were cut. But because of those cuts, there were no case managers, so the hospital released somebody, and there was no one to release them to, so they ended up on the streets, and that's what we're trying to fix. And there was a big tragedy in Maui at the end of December, where a young man his schizophrenia was getting worse and worse. His symptoms were getting terrible because he was confused about his medication. He called the police, and he said, "Please help me, take me to the hospital. I'm not doing well." he was taken to the hospital, he was given medication, and the hospital had no recourse but to let him out. He went to Long's drugstore, he shoplifted some beer. At 5:30 in the morning, the store manager came out to his car and said, "Give back the beer," and this man ran over him and killed him.
Oh, boy.
So we have a system that has lots of cracks.
Lots of cracks indeed. Lots of cracks indeed. Well, IHS has always seemed to me that as a place that does an awful lot of things for folks who are homeless, and yet I lecture in the spring to some groups that come in from Japan and the mainland students, and they stay in Waikiki. And I always said, I'm not supposed to talk to them about problems in Hawaii, and so I ask them, what do you see as the biggest problem? The biggest problem is always homelessness.
Yeah.
Homelessness in Waikiki. They said they're taking over Waikiki, and they say that people are either addicted or they're disturbed. How do you deal with that? I mean, these are the problem with, it seems to me, with part of the stigma is the stigma goes out into the community in a way that makes people angry or frustrated rather than embracing and trying to solve it.
Right. I don't think people make that much distinction, as you mentioned, between people who are suffering from a mental illness and someone who has a substance abuse problem. Both of those different types of subpopulations of people who are homeless need help. Some of them are not willing to get help, at a given time. But I think outreach, homeless outreach, is really about trying to develop those relationships to support people, to motivate people, to look at what they could do differently. When it's done right and when you can build the relationship, you're able to help them make a different choice. But for some of the people, if they're drug affected and they're high on ice most of the time, they're probably not going to make a decision to get off of it. They're addicted. That's the nature of addiction. You don't want to give it up. And in those cases, it seems to me that some of those folks may need to get their treatment by being picked up for violating the law, for substance abuse that is definitely against the law. And we don't do that. We are not in the position to be able to do that somehow. So I think that right now, there's a lot of people that we can encourage to come into IHS. When we do our outreach, there are people that about 30, we're able to convince about a third of them to come in when we do outreach. But there's a lot of them that they're just not ready, to do anything like that.
A viewer in Hilo says, personally, I think violence and tragedy is emotional health, not mental health. Do you distinguish between the two? And I believe we recognize emotional health issues, then problems, if we recognize emotional health issues, then problems are more preventable. The stigma, treatment, everything is different. Any thoughts on that?
I see emotional health and mental health as the same thing.
I think maybe where she's coming from is when you feel loved and cared for, I think there is a different kind of outcome. So I don't know if she's referring more to that, not feeling a part of anything or feeling like they're not loved. That could be different. Yeah. And I think we need to be able to express that more. Oftentimes, talking with young people, I think there's that feeling.
What's the cause of mental illness? What causes mental illness?
Chemical.
Partly genetic. So there's there's a possibility you could inherit it from an ancestor, and then I think it's partly environmental. Trauma. Some terrible childhood traumas. So between the two of that, especially if you have both. For example, in my situation, my father had a mental illness, and there was also a lot of violence, guns, in my growing up. So I had a terribly traumatic childhood. So when I was 17, which is often when mental illness strikes, I became suicidally depressed. So I had both things. I had the genetic inheritance, and I had the environmental trauma. But 3/4 of all mental illnesses hit when the person is between 15 and 24, and yet half of them don't get any treatment.
Whoa. Oh.
Yeah.
There's about 32,000 adults in Hawaii out of the 1.3 million people that have some kind of mental illness. 45% of those individuals, adults, are getting some kind of help involving the state. a lot of folks are actually getting help outside of the state resources, and a lot of families are struggling with it. So that's where I see a lot of parents trying to ask for help. Yeah.
Noelani, do you have any genetic thing in your family's background?
There is some genetic in my family's background, yes. I think that, and you know, I really wasn't aware of it until, you know, my son became ill. So there's that. In some instances, it's also maternal age. I had my son at a later age. And there was also the issue of like, you know, having a virus when you're pregnant. So that's the other thing. And that also, I had that as well. So, I mean, there were a number of things that, you know, I kind of looked at it in terms of what it was.
So the causes can be several.
Yeah, the causes can be several, for sure.
And I think it also can be like cancer. I mean, it's a disease that strikes the brain. And so, there, you know, sometimes illnesses strike people and we never know the reason.
Recent high-profile studies have indicated that many antidepressants were basically ineffective. Why bother taking the medicines if they don't really work? Caesar asks. Any thoughts?
There are many medications that do work, and I've seen them work, you know, literally miracles with, you know, a lot of people. Sometimes there is a real struggle to find the right medication for someone, but I have to say that having been in the mental health field for a long time, medications have evolved so much, and they have fewer side effects, fewer severe side effects than they used to a long time ago. And so we really do have much better weapons against mental illness these days.
Can I just say a thing about antidepressants? First of all, I know they work because they work for me. Second of all, those studies were mostly, where antidepressants were shown to be not effective was with people with very mild depression. But they are demonstrated to be effective with people with severe depression.
Bill in Honolulu, people on Medicaid cannot find a psychiatrist who will take Medicaid. The state spends 1/3 of mental health budget, over $50 million, on only 196 patients at the state hospital. Isn't this a misallocation of funds?
Well, it's true. There are no psychiatrists that'll take Medicaid. That's true.
Why
I mean,
not?
Virtually none. Well, because it doesn't pay well and the paperwork is terrible.
The reimbursement is very low, so that's another challenge. In Medicaid, generally, physicians are having a hard time supporting people on Medicaid because the reimbursement is low. We are going to be seeing an increase in the Medicaid reimbursement very shortly with the advent of the Affordable Care Act. So I think that has some hope. We do need to engage more psychiatrists in this area.
He's right.
So if you need a psychiatrist, you have to do it with private funds, or your health care, do most?
Well, if you're on Medicaid, the Medicaid plan you're on, the provider has the obligation to find a psychiatrist who will see you. But in some communities, that's nearly impossible. So,
because they won't see.
We had a call from somebody, and he'd called like 20 psychiatrists, and every single one of them would not see him because he had Quest.
Whoa. But and to visit a psychiatrist, and does a normal health plan like HMSA or so provide for psychiatric treatment?
Yes,
they do.
It does.
Yes, yes.
So indefinitely?
We have parity in this
We
state.
passed parity in 2003.
Which means what?
Basically, you're no longer limited if you have certain mental illness. You're no longer limited to see the doctor.
So, for example, if you need to be hospitalized for a physical condition, that can't be more than, you have to equal number of days in the hospital, whether it's mental or physical.
Yeah. Before they were limited because you had mental illness. So now you cannot do that.
How many of the 150 homeless that live under the airport overpass need mental health services? What's your guess?
My guess is that if you're talking about mental health as in a major mental illness, that would be not as many as people who need substance abuse treatment. There's a lot of people that need substance abuse treatment.
Is substance abuse treatment ever seen, or is it ever perceived as self-medication?
Oh, absolutely.
But then it becomes addiction,
Yeah.
And then it becomes addiction.
and then it doesn't work.
Right.
You've compounded your,
Yes, now you have mental illness and addiction.
Right, right. What, if you were, let's say that, I can't say that I mean, I've lived among professors and, you know, we're a pretty bizarre lot. But I
A little bit of mental illness there.
I think it's a requirement for a PhD. But no, I don't mean that. I don't mean that. But I wonder if I would know the symptoms of somebody who was in deep trouble, and where I could help them or realize that they needed help. What would I look for?
Well, I think you look for a change. The first thing is a change. Is there a change in this person's appearance? Is there a change in this person's behavior? Are they less outgoing, or are they a little bit too outgoing? I mean, is there something that's different? And you know, do they seem depressed? Do they seem sad? Can you draw them out, and can you talk to them? So those are some of the signs.
Are they coherent? Yeah. That can be another thing.
Are they able to focus?
Yeah.
Where they could before, but now they cannot.
Oh.
Do they seem not to be sleeping? Or are they not getting out of bed?
Yeah.
I've had both those problems recently. They should never have closed the Kailua Counseling Center a few years ago. About 100 people fell through the cracks when the state closed it. Government needs better leadership so those things don't happen. Agree?
Yes, I agree.
Yeah.
I think we all agree.
This happened after the economic downturn.
Yeah, I remember when that happened.
John Michelle from the Big Island. Why not tax toy guns, violent videos, violent comic books, and violent movies to fund the gun control program and help decrease purchases of these terrible products, which tell kids violence is okay? Do you feel that our culture and our cultural atmosphere in any way, violent games, violent sports, and so forth? Oh, what a great hit he made on that wide receiver. Wow, you can hear it right up here in the stands.
Got a concussion.
He got a concussion, yeah. Did those things, and he may someday be a suicide if he gets enough of them. Are those things something that we should try to deal with, or is that just too big a thing to get our arms around?
I think we need to look at our environment. And I say our built environment because we do have an environment now where violence is glorified. And just your language in terms of, you know, hitting and so on and so forth. And I think Suzanne's comment earlier about love and how do we infuse that into our system so that people, irregardless of what their situation is, what their condition is, that they feel that there are options and opportunities for them. I think we need to, as a society, really work on that. I think the laws can be passed, but you know, it's like President Obama said, this isn't just about me and Congress, it's about everybody. And I think we all have to sort of look at that, you know, where is it that I can contribute? What can I do? And then again, as has been mentioned, we have to have like the Kailua Clinic or the resources so that people have a place to go.
We need resources in the community where people live. We need them accessible, and I think the efforts these days to integrate primary care and mental health care are really important because that helps destigmatize also, because if you're going to a clinic and people know, oh, this is a mental health clinic, a lot of people don't want to go there. They don't want to go see a shrink. You know, they'd rather go see a primary care physician and be able to get some help there. And so I think the efforts to do that integration will be very, very helpful.
And is that part of the new healthcare law?
Yes.
Does this what's it called? Well, we'll call it Obamacare. Does
that Affordable Care Act?
The Affordable Care Act. Boy, those Republicans pulled a good one there. Rebranding.
It's a good thing. So it's a good thing. Obamacare is a good thing.
It's in the law that these kinds of distinctions will be.
The integration, it actually incents people to actually integrate services.
So when you go to your regular doctor, there could be a therapist or a psychiatrist there so you don't go someplace else.
I understand and sympathize with the mentally ill, but also feel that a person who is fantasizing or planning about getting a gun, killing as many people as possible before being killed by the police, have some responsibility to recognize that these thoughts are not normal and reach out for help. We can fund all the programs we want, but unless a person who is mentally ill or a family member takes that first step, they will continue to fall through the cracks. Is it difficult for a family member to take that first step?
Can I just interject something? I'm sorry, but what most people don't understand is that some of the most serious mental illnesses, which are schizophrenia and bipolar illness, one of the symptoms, one of the characteristics of this illness is they do not know they're ill. So it's not like they're not taking responsibility, it's not like they're denial, it's like they do not know they're ill. So whatever that reality is, they think it's a fact. So somebody says, you know, take this medication. Well, why should I take it? I'm not sick. So this person's saying, well, you know, I'm planning to get a gun, whatever. They think that's the correct and appropriate and right thing to do because their brain doesn't know that the brain is lying to them.
So in other words, there's really not the possibility of doing what is being suggested here.
Right, and family members may know, they may notice, they may think, but as we've heard all too often, these family members can't get people help.
That's why Bill, I think I really want Marya or Connie to describe what we're proposing this session. I think it's pretty significant.
Well, she's talking about the assisted community treatment bill that we hope will pass this legislative session. And what it does is it zeroes in on people who have already been diagnosed with a mental illness, have already experienced multiple hospitalizations, or what we call an MH1, where they've been taken to the emergency room before, because it's evidence that this person needs help. And once they've gotten the help, we want them to be able to stay on medications, continue to go to treatment in other forms also. So it really allows the court to get involved in some cases to be able to say, you need to take your medication and stay on treatment. And it's not just an open, someone can do anything to the person. There's a very defined service plan for the person, a treatment plan that defines what they will be taking, and it's for a 6-month period, so there's always a review. So it isn't like, forever you would be under this particular order. But it does finally give us a law with some teeth, something that will help us to say to the person, hey, you've been doing so well on your medication. If they're contemplating not taking their medication, to say, you know what, you really do need to take your medication because the court has said that you need to. A judge has decided that. So it really helps service providers who are really wanting to help the person to be able to do that.
This terrible tragedy in Connecticut has started at what has essentially been a 20-year silence on gun control. But it's also started a discussion which, very frankly, I haven't heard that much of, even at this table, where we talk a long time about a lot of things, on mental health. But how do you sustain that discussion? How do you sustain the interest in it? How do you sustain the bringing to people the idea of what has to be done? That's my last question of the show, I guess. We're almost out of time. Any thoughts on that?
I think we have to make it part of the conversation, our daily conversations. If people are hurting, we need to care, and we need to step up and just ask the question, as Marya mentioned, how are you doing? Just really care about the other person. That's the first step.
And so many families, there is not a person in this country that is untouched by mental illness. There's not one person, whether it's their parent or their child or their neighbor or their friend or whatever. We've all been touched by it. So we need to recognize that and not be ashamed to talk about it and not consider it, a dirty secret. And if we all do that, if everybody who's been touched by mental illness starts talking about it and acknowledging that people need help, I think we can change the conversation.
What are those phone numbers again? I think we have them. Do we have them? They're going to put them on the screen, I think.
Well,
anyway.
There is a crisis line.
The crisis line is?
832. 3100.
3100. And the number on the television right now is for the Mental Health of America of Hawaii, and it's 521-1846. 521-1846. If you could do anything to improve the situation for mental health and to sustain the conversation, what would you do, Noelani?
I think It is continuing for people to look at themselves because, as Marya says, everyone is touched by mental illness. And I'd like to think we're all touched by mental health too, and have some emphasis on that. You know, what can we do to improve mental health? Everyone's mental health. I think we need to look at it universally.
Susie, it's horrible, but I'm giving the politician the last shot on this subject. What's the best thing we can do to sustain this conversation?
It happens with each of us. I don't know how more simple it can be. If we care about this, we need to continue, be vigilant. It's not just another person's problem, it's all of our collective efforts. We have to
A community
do
problem.
it. Yes.
More.
Well, I thank you very much. I really do. I'm glad we stayed by and large away from guns. We'll get to that next week. Thanks very much for coming, and I've certainly been educated, which shows you how dumb I am. Next week, we turn to the more volatile issue of the Sandy Hook tragedy, the availability of guns. Gun control advocates hope that the mass shootings at Sandy Hook will finally tip the scales of public opinion in their favor, that new laws will ban assault weapons and institute universal background checks. This week, President Obama announced his 23 executive orders to reduce gun violence. In response, gun rights groups are holding steadfast in opposition to limits on gun ownership. Where does the Hawaii stand with our own gun laws? Is there more we could do to limit gun violence? That's next time on Insights on PBS Hawaii. I'm Dan Boylan. A hui ho.